I move the counter motion. So, Ceann Comhairle, I've welcomed the opportunity to address the House today on matters raised in the nursing home and nursing homes and this private motion tabled by the Labour Party. And equally, I don't doubt your sincerity on the issue. I think we all want to get to a point where we have a better, fitter service for the elderly in terms of nursing homes. So, Ceann Comhairle, I move the counter motion. To begin, I wish to acknowledge the RT Investigates programme that was broadcast on the 4th of June. This hard-hitting and harrowing programme highlighted a litany of poor care standards in 2 nursing homes, showing clear neglect and abuse of older people, namely the residents' Portlaoise and Bennevan Manor in Glasnevin. The welfare of both the residents and their families was obviously at the forefront of my concerns following the RT programme. I'm very conscious of the impact this programme will have had on residents, their families and the staff in the nursing homes featured in the broadcast. I'm also conscious of the impact it will have had on nursing home sector more generally and their residents, their staff, and it's important to acknowledge the committed, compassionate and dedicated providers and care staff operating in nursing homes across the country, which you've all acknowledged. Like everyone else watching the program, I was shocked and deeply concerned at the level of non-compliance with care standards and evidence from the distressing footage that was aired. I want again to state categorically that every nursing home resident deserves and should expect the highest standard of care at all times. Poor care, mistreatment, neglect or any form of abuse of any person living in a long-term residential care centre is completely unacceptable. I expect the highest standards of care to be upheld by providers for every resident in every nursing home across the country. And anything less than this standard will simply not be tolerated. And I welcome the confirmation that referrals have been made to An Garda Síochána. I've had extensive engagement with key stakeholders in the nursing home sector as well as HICWA, including the HSE and representative bodies in the sector, and I am continuing this engagement with immediate focus on delivering the highest quality of care to residents of nursing homes in Ireland. But responsibility for the safety and care of residents ultimately rests with the individual providers of each nursing home and their staff. The governance and management of nursing homes is a critical aspect in ensuring the safety and welfare of all residents. Staff must be equipped with the tools and supports they need to provide those in residential care with person-centred care. As a national independent regulator of nursing homes in Ireland, I expect HICWA and the Office of the Chief Inspector to utilise all available powers to them to ensure rigorous oversight and accountability in nursing home care. And HICWA's role is to ensure that the system structures and processes that have been put in place by a nursing home work to ensure safe and effective care and support for residents in residential care. I and the Department of Health officials met with HICWA on the 4th of June to discuss the regulatory activity relating to nursing homes featured in the RT Investigate programme. At this meeting, HICWA Chief Inspector confirmed his continuous intense engagement with the 2 nursing homes in question. And as requested on the 13th of June, HICWA furnished me with an interim report on their engagement with the 2 nursing homes featured in the RT Investigate report, which was published on the 17th of June. This interim report details HICWA's inspection of these 2 nursing homes since the programme was broadcast and their ongoing work in this regard. It also provides a brief overview of the MES Ireland Group. And HICWA has completed a series of unannounced inspections of both nursing homes in the evening, in the early hours of the morning and during the day to ascertain the level of care being provided at all times, day and night. Both providers were issued with an official warning of cancellation registration should they fail to implement significant improvements in the care of residents. And on the 20th of June, as requested, I received a further report from HICWA which provides an overview of the MES Group, the entire MES Group in Ireland, as you say, the 25 nursing homes, providing a comprehensive overview of the regularity history, including but not limited to regularity compliance, escalating enforcement actions and any additional conditions of registration. And this report was published yesterday. I and Minister Caroline Neal, with the Department of Health officials, met with HICWA on the 17th of June and on the 30th of June to discuss both reports. At this meeting, HICWA advised they are continuing their intensive engagement with the MES Ireland Group of nursing homes. The content of findings of both reports have been considered, including the need for additional regularity powers in respect of nursing homes, with action in this regard as to be taken as a matter of priority, and I cannot underline that enough. It's an absolute priority for me and government. HICWA has acknowledged the importance of examining its processes and methodology, essential that these are continually looked at for ways to improve the inspections and regulations in nursing homes. And HICWA are undertaking a review of the effectiveness of the Chief Inspector's inspection and monitoring process This review will include such elements as how to further strengthen the monitoring and leadership, culture, governance and management in nursing homes, how to better capture indicators of staff culture and other areas of service delivery which are critical for safe and good quality care for residents. And I have also requested that when there are compliance issues identified in a nursing home, HIQA should monitor more closely the corrective actions taken by nursing homes towards achieving compliance, and this information should be included in HIQA's published report. This makes common sense. So when you publish a report at the moment, the report deals with what happened on the day of the inspection. I want the report to not deal with the day of the inspection, but the compliance actions they're required to implement, and whether they were implemented or not. This is common sense. So a report is in real time, and if we have people going up on the HIQA's website and they look at the HIQA inspections, they will not only see what happened the day in the inspection, they will see what happened since. So when they are looking for their loved ones to go into a nursing home, they know what's the situation now. That's hugely important, and I've asked HIQA to implement that, and they will. It is acknowledged that the nursing home sector has evolved in Ireland over the last 30 years from a predominantly state-led situation to a situation where approximately 80% of nursing home services are provided by the private sector. I'm fully aware of the investment trends in the Irish long-term residential care market, the growing consolidation of the sector and the complex investment and ownership structures that now exist, which you've referenced in nearly all your contributions. It is therefore important that all aspects of the nursing home sector are scrutinised over the coming period to ensure that the service delivery in configuration meet the needs of service users in a sustainable and safe manner. This scrutiny includes a review of ownership structures to enhance transparency and strengthen accountability in the long-term residential care sector, carrying out an evaluation of the implications of complex corporate ownership structures against current regulatory powers would then require regulatory reforms. So as it stands at the moment, HIQA can regulate the individual company that's a service provider. It doesn't have jurisdiction over the parent company and the umbrella group. I want that, and we will implement that. The Chief Inspector in HIQA will also soon have additional powers regard to a serious patient safety incident in nursing home. When Section 68 of the Patient Safety Notifiable Incident and Open Disclosure Act 2023 is commenced, the Chief Inspector will have the power to carry out a review of an incident which may have caused an unintended or unanticipated death or serious injury to a patient, and which occurred in the course of provision of care to the patient. I want to state that Minister Karen O'Donnell and I are fully committed to introducing an adult safeguarding policy for health and social care, including nursing homes. The policy will commit to the development of adult safeguarding legislation for the sector, including nursing homes, and will build on a range of existing legislative policies and procedures already in place for preventing, reporting and responding to abuse. The policy in an advanced stage now intends to bring this to government as a matter of priority. And the government has included a health adult safeguarding bill in its current legislative programme to facilitate this, that this will be important for the development of preventing and protecting vulnerable adults from abuse. I would also like to advise the House of the ongoing work by the Department of Health to develop a framework for safe staffing and skill mix for long-term residential care settings for older people. The framework is a systematic evidence-based approach to determine the number of nurses and healthcare assistants required to provide safe and quality care based on patient need. This work is nearing completion, and I expect to receive recommendations for how this can be implemented shortly. And furthermore, my discussions with HIQA, I've asked them to look at that where there is a change in the profile of nursing staff, of staff in a nursing home, that they would be required to notify HIQA. It's a hugely important point. And that's a practical measure that can be done by HIQA. This government is committed to continue investment in healthcare infrastructure which supports the highest quality of care for older people. It is recognised that long-term residential care will continue to be a crucial part of the overall continuum of care. Proven Government commits to building more public nursing home beds in the context. The Department of Health alongside the HE is currently developing a new public long-term care additional capacity plan which will be published in 2025. Delivery of additional public long-term measures will deliver on the programme for government start to care and Project 2040 commitment. This plan will be formed the HSE Service Capacity Review and Future Capacity for Older People, which will be published on Monday. Which was published on Monday by the ESRI. You spoke about the built environment. Its empowerment and partner the built in location long-term residential care settings supports high quality care, positively for our older population. The government is therefore committed to creating new design standards for long-term residential for older people across all sectors, the common benchmark against which standards of the setting can be measured. I'm running out of time, so I'm just going to statutory home care, absolute priority for me. working on the legislation to legislate for home care providers. That will be the first step. I'm looking to bring that to government with Mr Cabinet Neil as a matter of priority. We're increasing funding on home care. In terms of the age of profile of population, we've set up the Commission on Care of all the people that are doing a body of work, which the first module will publish shortly. Can I just finish by saying, as Minister for All the People, Minister Cabinet Neil, the government, we're absolutely committed to ensuring that everything possible is done to ensure distressing scenes we witnessed in the recent RT investigation crime probe do not happen again in any nursing home across the country. And I want to state very clearly that every nursing home resident deserves and shall expect the highest standard of care for it all. My abiding concern is the older people in nursing homes. Everything is about improving the care and safety for them.